In fact, in the past, the treatment of delusional disorder was regarded as that they are resistant to treatment. But now this, understanding or this concept is changing, and it has been seen that the outlook has changed or has improved for the treatment of delusional disorder, and now it is more, or it is in fact less pessimistic as it was before. So now we are seeing that the treatment is helping many of the patients with delusional disorder. Now, when we talk about the goals of the treatment of delusional disorder, so what should be the goals when we are treating patients with delusional disorder? So some of the important goals is one should have a careful assessment, and one should establish that yes, the patient is having delusions. So this is one important point. One should then decide appropriate interventions. Again, interventions we'll talk about. We can use drugs and we can use therapy. So one should then decide that what intervention one want to use. And also one should be able to manage complications. One should be able to know when it is required to hospitalize the patient. So all these things one should be aware of. So these are some important goals when we treat a patient with delusional disorder. Now, coming to how to establish a diagnosis in the assessment. Again, it's very important that one should rule out other causes, as we have talked about various causes, especially general medical condition, neurocognitive disorder, substances. These are some important causes one should rule out. And one should confirm the absence of any other psychopathology, which would also rule out other psychiatric disorders. Also, one should assess consequence of delusion related behavior. Many times, fear, depression, anger, those symptoms may be there. So one should carefully assess those symptoms and their consequences. And many times the symptoms or the disorder may have an impact on various domains of the patient's life. For example, financial, many times legal impact is also there, as these patients are very litigious. They would want to take legal action. Even personal areas are also affected. So one should be careful. Then assess other symptoms such as anxiety, assess other behaviors such as agitation, violence, suicide. Again, these important symptoms or behavior should be assessed in the patient, and ultimately one should assess whether there is any need for hospitalization, because many times these patients may require hospitalization. As we have discussed, these patients usually would not by themselves would go to a psychiatrist, and many times insight is absent, so one may require hospitalization as well. We have two options, or we have two pillars of treatment. One is pharmacological management, where we can use drugs, and we can also use psychological therapies. So let's talk about these two one by one. Again, many times these two may be required together in the treatment of the patient. So let's talk about psychotherapy, and let's try to understand that what all important things we should keep in mind, especially when we are treating or we are seeing a patient with delusional disorder. Now, in psychotherapy, it's very important to establish an effective and therapeutic doctor-patient relationship, and it's very, very important that a trust builds up between the patient and the doctor. Even if you are giving medicines, even if you are treating the patient with pharmacotherapy, it's very important to build a trust, because if the trust or a good therapeutic relation between patient and doctor is not established, patient may not be compliant with medication as well. So it's very important to build this relationship, and very important as a psychiatrist, you should know that many a times this is not easy. So many times it's very difficult. It may take time to build a good relationship with the patient for the treatment. And psychiatrists should also be able to respond to patients' mistrust for others, and many times for themselves as well. So patient may have mistrust for other people, and sometimes there may be mistrust towards the psychiatrist as well. So one should be careful that these things can occur, and one should be able to respond well, so that the trust is again established with the patient. Because if trust is not there, it's very difficult to have a good effective treatment with the patient. Now, satisfactory social adjustment sometimes is more important when we are treating, rather than the abatement of patient's delusions. So ultimate goal may not be that delusions are totally disappeared from the patient, but many times patient having good social adjustment may be more important goal in the treatment of the patient. Again, since we have talked about it's very difficult to have a good relationship initially, it's important that one should know that individual therapies are seen to be more effective than group therapies in patient with delusional disorder, and one should prefer whenever possible to have individual therapy for the patient. And some of the therapies which have been seen to be effective in delusional, these therapies include insight oriented therapy, supportive therapy, cognitive therapies, and behavior therapy. So some of these therapies may be used and they are found to be effective in delusional disorders. Now let's try to understand, again this will be very helpful when we are seeing a patient with delusional disorder. What are the important things one should do and what are the important things one should not do or avoid when we are dealing or we are assessing patients with delusional disorder. So one should not agree. So it's very important that neither you should agree or neither you should challenge the patient's delusions, especially in the initial part of the therapy. So it's very important that one should not do these things when we are assessing, because many times if we do these things, it may break the trust between the patient and the doctor, and the patient may not be able to participate, or we may not be able to do a proper treatment for the patient. Now, some of the do's include that one should ask about the delusion. It's not that we should not ask about the delusion. One should try to ask so that we can establish the extent of the delusion. But yes, one should not ask persistent questions. If you feel that the patient is not comfortable or the patient is not ready to answer the question, one should not be very persistent in asking questions related with the delusion. So this is again a very important point. But one should try to ask question initially so that we can establish whether the patient has delusions or not. Avoid making disparaging remarks about the delusion. So don't make any remark about the delusion, again, which may break trust between the patient and the doctor. But on the same end, you should also be sympathetic with the patient and try to indicate that patient's preoccupation with delusion, you can understand that it is causing a lot of distress or it is interfering with the constructive life of the patient. So one should know that the doctor is able to sympathize and the doctor is able to empathize with the patient's problems which the patient may be having because of delusion. So it's very important to sympathize with these patients. Now next is very important that one should emphasize on helping patients' anxiety and irritability. So many times patients have these symptoms secondary to delusion. So one should try to help them without suggesting that you are treating a delusion, because in the initial part, the patient may not agree that he's having these symptoms as they are delusions. So it's very important to help the patient in other symptoms which the patient is having. Also, don't support the notion that delusions are real. Again, it's very, very important that you should not acknowledge the delusions, because ultimately this may increase symptoms and ultimately it may break the trust between the doctor and the patient. So it's very important to not acknowledge these delusions to be real. Now next is when in the therapy, when after some time the patient's beliefs they tend to waver, then you can increase the reality testing. You can help the patient to identify that these delusions are not true or these are false thoughts. So then we can help the patient to get in more touch with the reality and understand the untrueness of these delusions. Empathize with the patient's experience of being overwhelmed by these persecution. Again, it's very, very important for a good therapeutic alliance to emphasize, how much overwhelmed the person may be because of these delusions such as persecution. So one may use certain phrases that, you may tell the patient that you must be tired considering, what all you have gone through in your life or during this span of these problems. So one should try to be empathetic towards the patient and understand that the patient may be overwhelmed because of these symptoms. So it's very important for the good therapeutic relationship. And family members may be involved in the treatment plan, and at times family members inclusion may be required to establish a delusion as well. But one should not go behind the back of the patient. The patient should be having, should be kept in the loop that family members have been interviewed. It's very important to maintain the physician-patient confidentiality. Anything which you have discussed with the patient, and if you are planning to discuss it with the family members, you should take permission from the patient. So it's very important to maintain this confidentiality, and communication from relatives are discussed with the patient. This also should be done. So anything which you have discussed with the family members of the patient, you should also convey it to the patient as well, so that the trust between the doctor and the patient is not broken, because many times there may be a very thin line between this trust, and these things may break the trust and break the therapeutic alliance with the patient. Now let's talk about the reliability of therapist, which is very essential in the treatment of the patients with delusional disorder. So one has to maintain this reliability, and some of the important points while you're treating a patient you can keep in mind. First of all is, whenever you are seeing a patient, always try to be on time. Never give an appointment and reach late. Again, these things may break the trust. Also, try to make appointments regularly as much as possible. You are able to see the patient regularly. But also during the therapy, also avoid over gratification. So maybe, for example, don't extend the time of the session. If the time is over, try to finish the session. Or don't give any extra privilege or any extra appointments to the patient. And sometimes when you're in private practice, don't be very lenient on the fees. So sometimes these over gratifications may be avoided, especially in patients with delusional disorder, because many times patients start demanding more, and the patient should know that all the demands of the patient may not be fulfilled, because ultimately if some of the demands you fulfill and some of the demands you're not able to fulfill, again this will break the trust and would again lead to poor therapeutic alliance with the patient. So it's very important that one should keep these points in mind when we are dealing with patients with delusional disorder. As the delusions become less rigid, some depressive symptoms of the patient may also surface. Some of the symptoms of weakness, of inferiority, or these depressive symptoms may surface. So it's very important to understand that these symptoms may develop, and one should also carefully able to manage these symptoms as well. Now, when should we consider hospitalization in these patients? So it's very important that usually we treat these patients on OPD basis. So most of the treatment is done by OPD basis, but many a times patient may require hospitalization. So one should be again knowing when to hospitalize these patients. So first is, if you need a complete evaluation, for example, medical or neurological evaluation is required, and maybe it is not possible or the patient is not cooperative, and many times to rule out certain other conditions we may have to do these examination. So in those conditions we may admit the patient. Then in the assessment of violent impulses, many times patient may have violent impulses, suicidal or homicidal impulses. In those cases, if you are able to assess, or if you doubt that these may be present, then you may admit the patient. And also, if these are causing significant impact on the patient's functioning, so patient social, occupational functioning, occupational relationship, these are getting affected because of the delusion, so then also we can consider admitting the patient. And many times patient may not agree for a voluntary admission, so many times supported admission or involuntary admissions may be required in these cases. So this was about important psychotherapeutic interventions which we may do. Now let's talk about pharmacotherapy. Again, there are not adequate trials which suggest that medicines or drugs are very effective in treating delusional disorder. But usually we see that antipsychotics, so whatever studies, smaller studies have been done, they suggest that antipsychotics usually are the first line drugs. And many times, especially when the patient is severely agitated, in those patients, IM antipsychotics can be given. So usually antipsychotics are the first line drugs. But many times, as we discussed, the patient may not be having insight and the patient may not agree for medication. So patient may refuse medication. And especially when you have admitted the patient, one should not immediately insist for taking the medicines. One should wait and one should establish a good rapport, a good therapeutic alliance with the patient, and then maybe gradually you can start the medication. But it's very important in these patients, one should again tell the patient, explain the potential side effects, because many drugs may develop these side effects. So one should tell the patient that yes, these drugs may have some of these side effects, because if these side effects occur and you have not told the patient, the patient may think that the doctor has lied, and again it will break the trust between the doctor and the patient. Now coming to the antipsychotics, it is seen that some of the studies have shown that haloperidol, risperidone have been shown to be effective in some of these patients, and we can start at low dose and gradually we can increase. One very important drug, that is one of the first generation antipsychotic drug which have shown to be effective in some of these studies is pimozide. So pimozide again is a drug which has shown some role in delusional disorder, and especially in somatic delusion it has shown to be some role. So pimozide may be one of the drugs one can consider. Now let's talk about drug failure. What is drug failure? When the patient fails to respond to the drug at a reasonable dose for around 6 weeks. If there is no reasonable response, then we say that there may be drug failure. When there is drug failure, some of the important points one should consider is that one should check for non-compliance. Many times it is actually because the patient is not taking regular medication. So one should try to rule out whether the reason is non-compliance. Also, if one is seeing drug failure, one should try to concurrently also do psychotherapy. Again, it has been seen that many times medication and psychotherapy may play important roles and may be done simultaneously with the patient, especially when you are giving medicines. And we talked about how to deal with these patients. So it's very important to deal with these patients in those ways which we have discussed, which can also help to improve compliance and may also prevent drug failure. But if there is no benefit whatsoever you have seen with the drug, then one should stop the drug if there is no benefit. So these are some important points one should consider. Now there are certain other medicines also, although no proper studies or large studies have been done to evaluate their effectiveness. Some of these drugs such as antidepressants, lithium, valproate, carbamazepine, these may be effective and trial may be done, especially when there is no response to antipsychotics. Then you may consider starting some of these drugs. When there are features of mood disorder, so many of these drugs again we use when we treat mood disorder. So if the patient has features of mood disorder, you can try some of these drugs, or if there is a family history of mood disorder, then also these drugs may be used. So this was about management of delusional disorder.